In this video, we're going to look at the region booklet for the lumbar and thoracic region. So in this booklet's part 1 and 3 have been completed, but there are still parts to complete in part 2, plus parts 4, 5, 6 and 7. So for part 2, you need to be able to locate, palpate and list the actions and attachments, so the origin and insertion of the following myofascial units. So for iliocostalis, you need to be able to identify what the actions are. The same for longissimus, so the actions of it. Scrolling down, the rest are fine with the exception of psoas major, which wasn't filled in at all. So for psoas major, you need to identify the origin, the insertion, and the actions. For part 4, you need to perform active range of movement, passive range of movement, and resistive range of movement on the following myofascial units. For active range of movement, you need to list the muscles that are shortening. For passive range of movement, you need to identify the muscles that are lengthening. And with resistive tests, you need to list the muscles that are acting isometrically. So we have trunk flexion. So for AROM, the client is sitting in the massage table with their arms crossed across their chest, and the client is bending forward. For resistive range of movement, the client is sitting on a massage table with their arms crossed over their chest, and the therapist is resisting trunk flexion, so there is no movement. Trunk extension. Active range of movement part of this is the client is in a prone position and the client arches their back, lifting their head. For resistive range of movement, the client is in a prone position and the therapist resists trunk extension, so there is no movement. For trunk rotation, the client is seated on the massage table, arms crossed over their chest, and the client rotates their torso to the left, then back to the right. For resistive range of movement, the client is seated on the massage table, and the therapist resists their trunk rotation, so there is no movement. For lateral flexion, active range of movement, the client is seated on the massage table with their arms crossed across their chest, and the client moves their shoulders laterally and down, thereby flexing the trunk, and this is done on both sides. The resistive part of this, client is seated with their arms crossed across their chest, and the therapist resists lateral flexion, so there is no movement. So with those parts, we're just looking for the muscles that are going to be involved in performing those movements. Remember, the AROM and the resistive range of movement muscles are going to be the same, so you don't need to identify the passive range of movement muscles. For part 5, you need to perform the following special tests for the lumbar and thoracic region. So again, we need to identify what the objective of the test is, what a positive finding is, and then how that test is performed. So we need to do this for the Thomas test. We need to do this for a straight leg raise. We need to do this for the prone knee bend. We need to do it for the slump test. And we need to do it for the stalk test and quadrant test. For part 6, we need to perform and describe massage techniques on the following structures. So again, the regions have been given to you, but you need to describe what the techniques you would do from a massage perspective. So for the psoas major, being a strain in the subacute stage, working on the contractile tissue. The second one for erector spinae, so the contractile tissue that are hypertonic. For quadratus lumborum, the contractile tissue. For an iliolumbar ligament sprain, the inert tissue. For part 7, you need to identify the remedial treatment protocols for specific disorders that are related to body regions. So this is going to include what massage techniques would you do, any endangerment zone, so the areas that you're going to stay away from, and relative contraindications, as well as possible yellow or red flags. So that's all going to go within the massage technique side of things. And with that as well, you're going to identify the duration and the depth of those techniques. So how long are you going to do a certain technique on a muscle for, and how deep are you going to go? So are you going to work superficially with it, or are you going to go deep? And that might depend on the stage that that injury is in, or it might depend on what other muscles you need to be able to pass through to be able to act on that muscle. So the conditions you need to do this for is the interspinous ligament sprain if it's been overstretched, a disc herniation, thoracolumbar fascia with increased tone. And that will complete this region booklet. Any questions, please chat with Paula or Emily and we can explain this further.